rise is the awareness of inflammation's role in diseases that weren't historically thought to be inflammatory in nature.
Okay.
So, for instance, heart disease is now thought to be an inflammatory disease.
Right.
Right? Alzheimer's is an inflammatory disease.
So, okay, so let's go. So what's actually happening then when we talk about inflammation? If it's if you're saying that heart disease is now considered an inflammatory disease, what's actually inflamed? What's happening in the body?
Well, the the disease process in heart disease is actually disease of the coronary arteries. The coronary arteries are the arteries that actually emerge from the heart itself and supply itself with blood, because the heart is a muscle,
Right.
and it needs blood and oxygen just like everything else in the body. So it's got these specialized arteries which basically come out of itself and supply the heart muscle. Heart disease is the process by which those arteries become either narrowed or blocked over time.
Mm-hmm.
And in the most catastrophic cases, it's a sudden blockage of one of the major coronary arteries that leads to complete occlusion and obstruction of blood flow to major parts of the heart. And this is known as a heart attack or an acute myocardial infarction. So this is a relatively new disease in the grand scheme of things. You know, in the 1920s, there was very little heart disease relative to today, where it's one of the major killers, certainly in the Western world. And the disease process itself has become better and better understood. But I guess the simple answer is that there's this irritation of the walls of the lining of the coronary arteries. They become damaged, inflamed, and then there's this whole inflammatory cascade process that leads to the gradual blockage or sudden blockage of the coronary arteries, aka heart disease. So it's just one case of chronic inflammatory disease, and of course, you know, the pathology that affects the coronary arteries can also affect the arteries supplying the brain or any part of the body for that matter. It just tends to occur in areas of high shear stress, you know, high pressure. So, but inflammation, it must be said, is a normal biological process. Without inflammation, we die.
Mm-hmm.
It's fundamental to our survival. So it's not the case that inflammation is bad and lack of inflammation is good. That's actually not true at all. We need inflammation. We've evolved to have it, and it's our primary defense mechanism against foreign invasion or injury. So when you know, I've written articles, I guess, about this. If you roll your ankle in a netball game, your ankle becomes inflamed, right? And we all know what the signs of inflammation and the sensations of inflammation are in that sense. There's swelling, you know, pain, redness, right? It becomes hot to touch, and we can't function as we normally do. They're the 5 features of inflammation. And of course, the whole purpose of the inflammation in the case of the rolled ankle is to bring is twofold, I suppose. It's to bring the first aid kit to the ankle, so increased protein and cells that are involved in the healing process, and also to cause pain so that you don't walk on it.
Mm-hmm.
Right? And so that's a normal thing.
So a
But
protective mechanism, a natural protective mechanism that the body.
absolutely, absolutely. The same as, you think about when you get a cold or a flu, you get all this congestion in your sinuses and in your head and your nose and your ears and all that stuff. That's inflammation. That's not, that's, there's more of your cells and stuff that your cells have produced in that discharge than any foreign cells. But the whole stickiness, muckiness, congestion is a means to stop the bugs from spreading any further. They can't wade through the mucus. So that's I guess at a high level, the purpose of inflammation. It's to start the healing, prevent any further damage, start healing. But inflammation can occur anywhere in the body. So it can occur in the gastrointestinal tract, in both in normal functional ways, okay, like food poisoning. So you eat something that's toxic, your gut reacts with inflammation and so on and so forth. And then in abnormal ways, like celiac disease, where your body has raised an inflammatory response, thinking it's attacking a bug, but actually attacking your own body, so-called autoimmune diseases. And there's a whole host of autoimmune diseases, including most notably type 1 diabetes, where the body generates antibodies to particular cells in the pancreas that are responsible for making the hormone insulin. So I think a good chunk of medical resource goes toward treating chronic inflammatory conditions.
Mm-hmm.
It would be a massive amount of time, energy, and money. And of course, on the patient side, a whole lot of distress and morbidity caused by inflammation that's unneeded.
Right. So just for clarity then, could you just define when you say chronic inflammation, that's like the bad inflammation, right? So you've got inflammation that's a natural response. Then where's the line when it goes from where do you see the line between inflammation and chronic inflammation? How do you define that?
Well, in medical school and in medicine, chronic is defined as anything that goes for more than 6 months. But I think that's a fairly dogmatic approach to defining chronic. I mean, chronic is really a process that's sticking around for a while, much longer than needed. Okay, so if you twist your ankle, you've got acute inflammation that occurs straight away, but it should fade. As you know, if you've rolled your ankle, it should fade within a few days, provided there's nothing more serious going on, like a fracture. If that swelling were to continue any longer than that, say a month, in my mind, even though it doesn't meet the textbook definition, that would still be chronic inflammation and probably dysfunctional.
Is this a result, do you think, of lifestyle mainly? Like, what's the causes or the common causes of inflammation?
Yeah, it's a good question. I think it is. I think it is lifestyle. If we're honest, it's a combination of what we eat, what we expose ourselves to, sleep deprivation. There's a whole range of lifestyle factors that are involved in unnatural or out of balance inflammation. Mm-hmm. So, in particular, there are certain foods that are known to set off inflammation. So here's a good example. Gout is the accumulation of uric acid crystals within joints, and it occurs from eating particular foods in susceptible people. And then what happens is when these crystals appear in the joints, then you get this massive, way out of kilter inflammatory response, which is so painful. So, it leads to heat and pain and dysfunction, often in the big toe, but often some of the other joints as well.
Mm-hmm.
And that's due to certain foods that are consumed in excess. I mean, classically, that's alcohol, which we know is pro-inflammatory. Alcohol. There are particular there are particular vegetables which are known to, or other particular foods which are pro-inflammatory. Refined carbohydrate, classic example. We eat way too much of it generally. White bread, white this, white that, sugary treats, and so forth. All very pro-inflammatory. Um, Soft drink is notorious for causing inflammation. Processed meats cause inflammation. So no doubt we're eating stuff that's pro-inflammatory. And then I guess the good news is there are foods we can eat that tend to reduce inflammation as well. And of course, you and I are familiar with the effect of turmeric, or the active ingredient, or the active compound curcumin,
Mm-hmm.
which is remarkable in its disruption of various inflammatory pathways in the body. So it's certainly in scientific studies, benchtop studies, and in clinical trials, increasingly is found to be effective in reducing out of kilter inflammation. And it's been tested in some pretty hard to treat inflammatory conditions: endometriosis, Crohn's disease, irritable bowel. There's some conditions where it's been arthritis, classic inflammatory condition. Both osteoarthritis and rheumatoid arthritis, both of those have inflammatory elements that are amenable to things like curcumin, which is quite remarkable, given that's kind of just a root vegetable. But it's got, curcumin is it's part of a family of biologically active plant-based chemicals. So they're called polyphenols, which appear to be very active in disrupting both inflammation and even cancer proliferation. So watch that space, because that's really interesting.
It is interesting because a lot of our customers that are taking to curcumin, our Vitality curcumin, specifically for arthritis, they're not, as far as I'm aware, they're not making any other lifestyle changes. They're just putting this into their diet. So that's a pretty powerful natural substance, isn't it, to be doing that? Because you, as a doctor, right, you would recommend ideally making lifestyle shifts when someone's dealing with chronic inflammation or a disease like that, right?
I think so, and I think we're all kind of what's the best way to talk about this? I think we all deal much better when we've got some momentum behind us. So I think here's a classic one. I've known people that have had gastro, have lost a whole bunch of weight, which is fluid, if we're honest. But what's happened is they've lost 3 or 4 kilos, and it's given them the momentum to go on a diet and lose weight. And then once they've lost a bit of weight, then suddenly they get energized to go to the gym or start exercising, and this momentum builds. So I think what's good about something as simple as a food supplement is you can get a bit of momentum pretty easily. Your pain can go, you can feel a bit better, and then you're more likely to get on a health kick.
Yeah.
you're more likely to start choosing what you eat a bit differently and maybe exercising a bit more, cutting down on alcohol, cutting down cigarettes, or stopping completely. So
Yeah.
I think, again, it's a good, I've often talked about healthy habits. They're hard, there's 50 things you can do every day to improve your health. Meditate, stretch, do some yoga, do some weights, go for a run, go for a swim, you know, hug or kiss your partner, all these things. And you could go the whole day without doing any of them. But if you could do one or two, that's better than none, because then you might get some momentum to do three the next day.
Mm-hmm.
And I think it's just about staying, keeping some momentum,
Mm-hmm.
and understanding it's not all or none. It's a spectrum. You can do, a little bit, and that's cool too. There's something to be said for, and there's books published on this too. Make your bed,
Yeah. Yeah.
have a cup of coffee with your partner, talk, phone a friend, 10 minutes of stretching, maybe, do waking up meditation for 10 minutes,
Yeah.
just anything, just try and tick a few boxes, because the benefit accumulates, but most importantly, it defends against anxiety and depression and
Mm-hmm.
isolation and all that stuff, which is real. I mean, we're in really strange fucking times,
Yeah.
and yeah, and you've got to do something to stop. I mean, maybe the people listening are super resilient and super men and women, and congratulations. But for the rest of us, you've just got to do something. Yeah, take your vitamins, right?
Yeah.
Because it's something. Take your hang on to normal health-seeking life.
Yeah, there's something about that morning routine, about really just getting up and like getting in that headspace, have something healthy first thing in the morning, and then it just sets you off on that right track. Like you
Yeah,
said, rather than rolling out of bed and going, what's the point in making the bed? I'm not going anywhere.
that's right.
And then the brain just then goes into this downward spiral, right?
Yeah, yeah. I had to push myself to shave, or not just put on a shirt, but maybe put on some pants, because
Yeah.
in Zoom, of course, you can't tell whether I'm walking around in my jocks or not, and no one can. So I had to force myself to shave
Yeah.
and make my bed and all that sort of stuff. But I think in the end, I got wobbly. I didn't tip over the edge, mercifully.
Mhm.
And I think I had enough healthy habits going. I kept exercising. I kept taking my daily vitamin routine, etc. Did yoga and so forth.
I mean, if someone's struggling with inflammation or some kind of chronic disease as well, and then on top of that, you have the mental health aspect. There are
Mm,
studies, right, that when you're dealing with stress, it kind of the physical impact on
mm.
your health as well. It's directly linked, isn't it?
Oh, absolutely. Yeah, the link between mental and physical health is it may not be the pathway may not be scientifically established, but the correlation is most certainly there, and we all know it ourselves.
Mm.
You can make, by a change in mindset, you can make yourself feel better,
Mm.
and vice versa. If you start thinking, dire thoughts, you suddenly feel worse. It's not, it's a little mysterious, but we all know that's the case. So
Mhm.
the relationship is certainly true. I just, again, my advice to my patients is just, I say, look after, and we all say, look after yourself when we talk to our friends or our family. Look after yourself. But what that actually means is start a routine of health-seeking behaviour and healthy habits. That includes eating at least one meal a day that's healthy,
Mhm.
right? Sleep, trying to be in bed for enough time to sleep 8 hours. and setting up the environment to sleep 8 hours, phoning a friend, catching up at least once a week, even if it's on Zoom, if it's got to be, doing some exercise. I often set an exercise routine that is literally 5 minutes. And you know what? It's often said the hardest part is lacing up your shoes.
Yeah.
Because once you've done that, you're away.
Mm-hmm.
You know, it's just the first step you've got to take. I guess so. We're all in it together, right? We've got to, when we get good tips and good advice, we've got to pass that on. So I do wish my friends in the UK and Europe well. You know, in Australia, we are lucky now. You know, it's our summer, and more or less we're free range chickens at the moment. We've got, you know, sort of ongoing border closures here and there all around us, but for the most part, things look good for the moment. Mind you, they can change instantly, as we know.
Mm-hmm.
But
I think that's why we need to like build our resilience, right? Because we can't actually control anything that's going externally. But if we really start to take control of our health and like you said, it doesn't have to be massive overhaul, just like tiny things that kind of help us build our resilience, so that when things do change outside, we're feeling healthy, we're feeling a bit stronger, we're feeling like we can handle things a little bit more. So take your supplements, doctor's orders.
Yes, yeah, as I do. Thank you.
Thank you so much for chatting with me, Harry.
You're welcome anytime. Thanks, Lisa.